thank you. After some delay, well, I can start my talk, which I was asked to bring here our long-time colleagues from Russian University, Oriel Russian University, about the blood perfusion and NADH flavins content combined analysis in diabetic food. Well, I guess, do everybody knows or not? Okay. Let's outline usual introduction, methods, main idea, about device we designed for to deal with this diagnostic approach. Parameters we think will help to create diagnostic criterion. Of course, results and conclusion with acknowledgements. That's a pretty routine outline. Shortly describe what diabetes is for modern human civilization. So it's a real high risk. At the moment, well, a year ago or less, world population were in severe 415 million with diabetes, diagnosed actually. Very often people don't know about this. They have already developed or close to developing diabetes. And in 2040, the world will have 642 million diabetes. So the diagnostic approaches should, well, people like us should really consider not only measure the blood glucose in a blood stream, which is good when you diagnose, but also any other possible diagnostic approaches to deal with the complication. The main of which is more severe is damage of food. Due to damage of blood flow, it's blocked slowly, and the oxygenation of tissue goes down, so the metabolic process goes down. We have really severe ulcers on the skin. And also, another one, very painful, it's a damage of nerves in the food. And after this, we have really, really painful, let's say, constantly painful effect for patient. Patient can't walk. They always feel something really painful in the food. So it's a really disabled condition. Patient will face, patient with diabetes will face in between 3 and 5 years since it starts. And the next slides I would like to tell will be what's in the world, the so-called golden standard. They have, the medics have to test. The most primitive and subjective is palpation examination. So they check pulses in main arteries of the food on this side or the distal side. Ultrasound scanning of the big arteries, quite low efficiency at distal side. This approach actually shows radio contrast angiography. It can show precise the development of the vascular complication, diabetes-related vascular complication, but it's invasive, and contrast agent is toxic, and exposure of the patient to radiation. So it's a really tricky stuff to go for this, but it's used now. Other approaches is transcutaneous oximetry. It's time-consuming, low accuracy due to the different clinical factors like, well, the individual development of the disease or individual atomic stuff. Well, you need to put quite a lot of sensors to predict where is blocked arteries, what they will develop into later. And thermal imaging. The thermal imaging have got low boundaries of the, let's show low boundaries, low accuracy of the boundaries of trophic lesion. And what we actually offer is pretty simple methods. It's a laser Doppler flowmetry to measure blood flow, blood perfusion we call it, which we calculate quite simply from the number of the red blood cells per volume for wavelengths we use. It's a 1069. And the fluorescence spectroscopy to address question what's the level of metabolic activity in the tissue, which really affects if the patient has got the problem with vessels in food. And it's then brings the second effect, developing the necrosis in the skin and in the tissue. On second slide, this is what about the monitoring NADH. Well, it was first discovered in 1955, where actually NADH in fat produced and how mitochondria works. In 1997, they found that it could be measured like fluorescence signal. In 2007, the mitochondrial function in vivo evaluated by NADH in humans studies and animal models. And the latest one, this measurement of mitochondria, NADH and FAD out of fluorescence in living cell. So it's a really simple and well-developed situation. What happened when the blood shots, arteria shots in and not bringing blood and oxygen to the tissue? We have an anaerobic metabolic shift from aerobic to anaerobic in the cells. So the level of the NADH and fat should be quite high comparable with normal because they don't use. There is no oxygen, there is no mitochondrial activity. And this is a normoxia, so-called. This is a death when the highest level of ADH and the NADH because of mitochondria dies, ischemia, hypoxia, anesthesia, the different levels. And if we have really well ventilated tissue with the blood, oxygen, we have quite low, comparably low level of NADH. This is the main idea. So if we measure level of the NADH in the tissue and compare with normal level of the NADH in the diabetic foot, we can draw the conclusion. And it could be conclusion of diagnostic. The main idea for realization device. Well, it's everybody possibly in this auditorium understands that what happened with light when it shined to the tissue. It can give a number of effects like scattering, absorption, and then fluorescence. Raman shift, Doppler shift if there is some moving particles in an object, and there are moving particles in an object. We used 3 wavelengths in short wavelength bands, 450 3 nanometers and 365 nanometers to excite correspondingly NADH and FAD. And then we used 1064 nanometer laser, narrow laser to test the red blood cells velocity in vessels. And this is how this machine was developed, how it's look like. So there is 2 blocks. This is a measuring on monitoring blocks, which do in parallel measurement of fluorescence in the tissue, where the optical probe actually is located, and at the same time it's measure the velocity of blood perfusion in the tissue. And this you can see is a different temperature applied to with the next block, which operated with within the software developed for both of them. So it's a parallel. Everything is parallel. Physiological test or functional test, temperature test, can be done with a particular time scale regarding to what patient, what we want to do with the patient with measurements, and when we want to do it. And when we want to do it, when we measure actual parameters of laser Doppler flowmetry and fluorescence spectroscopy of the tissue. And it's look like how it's look like. So this is a probe. We measure 2 position between 2 toes. And here is, well, actually, clinician wants this one. They palpate here and looking for the pulse because of big arteria. So we compare them two. This is how it's look the temperature test on a food. It's quite big. This is a Peltier element with water. Unfortunately, we have to keep water cooling because it's not enough usual radiator. Otherwise, it will be too big. Just it's not useful for patient. And what we got was this data. Then the first stage, we do records, control records for 5 minutes just to get the feeling what the base tissue fluorescence and the blood perfusion has this patient on this particular place. Then we took 15 patients with diabetes type 2 diabetes, age around 60 years old. And the control group, again, 50 apparently healthy volunteers. The age was a bit lower than but because of the quite difficult to find at the age of 63 non-diabetic volunteers. That's a condition we live with. And so, well, there is kind of discrepancy between in these two groups in terms of age total. The second stage was the total 75 patients with type 2 diabetes, age 53, and they were on the temperature functional test, which was cold, 25 degrees. Then next was 35 heating and 45 degree. And these heats were applied, basic takes 40 minutes, and we have to keep heating when we apply heating of 42 degrees for 10 minutes because, well, that's a normal response of the body to bring down the temperature. So we have a sensor inside this Peltier element, so we can measure real temperature of the tissue. And the 10 minutes just was needed to bring real temperature of the tissue to the level of 42. Then we could measure for 4 minutes. And this is a typical fluorescence coming after excitation with the 365 nanometers. It's about an NADH fluorescence. And to be precise and keep separate this to signal fluorescence coming from different coenzymes, we use 450 nanometers. This is a backscattered peak. They are quite important. I will tell it about later. This is just the segment of the blood perfusion recordings with laser Doppler flowmetry. And the next will be the integral parameters for diabetes food diagnostics. Well, to measure only bulk fluorescence from NADH and FAD, in this case, what we found was high variety, even for one patient, due to really, when you test temperature, you really change all parameters of the tissue. Metabolic activity, blood perfusion, and velocity level, it changed dramatically. So we need to do something or develop some parameters will be integral. And we took a well-known ratio, redox ratio parameter, but using, as I said before, backscattering coefficient. It's really make this parameter more individual. So I don't know, you know or not, but when you shine light and get the backscattering, our skin is so individual, and even one individual can have different parameter which will be different between monitored skin in morning, afternoon, or evening. So the backscattering coefficient normalize fluorescence and take off all this individual stuff. So we used the redox ratio calculated this way, and average blood tissue perfusion, which was taken for a particular time, and average as a percentage. The last parameter, due to measurement of the two key core enzymes for metabolic activity in general, NADH and flavins, we can come to the assessment of metabolic rate, so the intensity of the body metabolism, why it's interesting for the diabetic patient, especially with developed diabetes. Well, because the diabetes, due to the shift in the metabolic rate, different between normal and diabetes patient. We used and bring the metabolic rate, which calculated when we normalize redox ratio to the level of blood perfusion, which is, believe me, have sense. Result of the first stage, when we only do without temperature control group shows this data, and the diabetes shows this. But in general, it's not, they were not statistically significant for this stage. But the second one, this is the second one, sorry, I didn't mention, shows that when we apply temperature test or heating on the school, we have significant difference in these parameters, practically in everything. So what happened when we apply physiological temperature control? The vasodilation of the vessels increased, and if there is some discrepancy in the metabolic problem, which usually diabetes 2 patient has got because of anaerobic shift, metabolism actually was shift to an anaerobic side. But in normal patient, or in normal volunteers, it doesn't exist. And playing with this and temperature physiological stuff, we can increase or find the significant statistical difference between diabetes and not diabetes tissues. And the conclusion, I believe, will be, sorry. And our results, that the heating test can be used as an assessment of the adaptive reverse of the oxygen delivery consumption processes in the tissue, as in general for research. At high vasodilation during the heating at 42 degrees, patient have increase in tissue oxygen content, and NADH is intensely oxidized in mitochondria, both in healthy and diabetes patient. But when we normalize and use the integral parameter, as I said before, we could separate, or, oh, sorry, I need to go before. We could, using the dynamics of changes in NADH FAD, it's more pronounced for the group of diabetic patients compared to the healthy one. So it's a nearly criterion, diagnostic criterion we developed. And the conclusion would be the next. You can read it. It's clearly that we can use result highly considered with the patient endocrinal profile. It's what I would like to say. We checked the patient medical profiles and level of the glucose in the blood, and it's what we observed during the temperature test. That's totally coincided with our data. So it is mostly all what I would like to say, and the acknowledgement to our friends in group involved. It's a biochemical engineering group from Aarhus State University, LASMA company which developed a device, Central Research Institute of Traumatology and Orthopedics in Moscow for consultation, and the volunteers from this endocrinology research center of Minister of Health of the Russian Federation, and the money which come from this grant and help from the innovation enterprise companies in Russia. Thank you. That's all.